Welcome to the Society of Hospital Medicine's Education Consult Series, brought to you by the SHM Academic Committee. This series is dedicated to providing hospitalists with practical, easy-to-use teaching techniques, tips, and resources from academic clinician educators.
Hi, I'm Jen Readlynn, a hospitalist at the University of Rochester Medical Center.
And I'm Dan McFarlane, a hospitalist at the Ohio State University Medical Center.
We're going to talk about some quick bedside teaching or clinical teaching today.
So Jen, I'm really struggling with my learners right now. I have a really busy clinical service. COVID has really taken off at our hospital, and I'm really feeling like my learners are really struggling, and I'm struggling to teach them something in the midst of just such a heavy clinical service. I was hoping that maybe you had some tips that we could use to help get my learners some extra teaching.
Yeah, I hear you, Dan. Things are going crazy right now. And I'm glad you asked this question. I think it's an important one, even in non-COVID times, of how do we fit all this teaching into a busy day, make sure our patients are taken care of and our learners are taken care of as well. So I actually have a few frameworks that I like to think through, but before I even get to that, we'll start at the beginning and think through some of the things we're going to talk about today, like our expectations of teaching, just a reminder for ourselves, strategies to incorporate that teaching into our busy inpatient service, and then some other resources that we can use as educators. So for me, it's always a good reminder to say, we don't need to see every patient as a team. And I know that can be uncomfortable for some people, but really we want to keep our clinical time rolling and really focus our learners during those rounds or teaching rounds, but keep things moving for our patients as well. We want to try to keep the flow going in the hospital as well as teaching our learners. And we don't need to teach every single possible point for the patient at one time. One of the things I love about being a hospitalist is I get to see patients evolve over time. And so every day we can think of a new teaching point for that patient and just teach one thing. It doesn't even have to be pathophysiology as well. You can teach about communication strategies or systems-based practice and just how the hospital works or how to move things along within the hospital to some more practical strategies for our learners as well. And it does not have to be a chalk talk or a lecture. I know that especially for medical students, they're very used to that coming off the first and second year, which is mostly lecture-based, but we have a little more flexibility and need that in our day too. And then really figuring out what your learners want to know, what they're interested in will help keep them focused as well. So those are sort of the expectations I try to keep in mind and go over with my team too.
So do you go over them at the very beginning? Because this is really helpful. I think it's nice to know that I feel like some of the pressure's off, that I don't have to teach everything about every patient.
Yeah, exactly. And I do go over that at the beginning to try to set that expectation early. And we have a whole other video on setting expectations too that may be helpful. But I find that the earlier I communicate with learners about what our expectations should be, the better. So I send an email at the start that kind of includes these things, but talk about it as a team as well.
Awesome.
So I also try to think through some different frameworks that I can use. One of the ones that's been adapted from the outpatient side is the 1-minute preceptor. And so you really let the students or residents or whatever learners you have on your team present the patient and then really go through this framework of getting a commitment from them, whether it's the diagnosis, the treatment, what the follow-up plan should be, whether they're ready for discharge. Just have your learner put their nickel down and say, this is what I think is going on or what we should do. And then get their understanding of it, their thought process, why they think that, why they want to do what they're telling you they want to do, or they think is the most likely differential. And then your role as the teacher would just say, no, I agree. In patients with this, then we would really do that, or make sure we also think about this. And then give your feedback right away. So you reinforce what was done correctly. You really thought through that patient well and came up with a broad differential, but then correct mistakes. Don't forget about this finding in this patient that may shift your differential a little bit. There's another framework that's similar called the SNAPS framework. That's more learner driven. So they have to learn the framework to do it. But we've got some great resources from the Journal of Hospital Medicine about that you can read up on further.
Yeah, I really like that because I feel like I always want my learners to commit to something, right? I mean, because I don't know whether they really truly understand it if I'm just telling them it to them, right? So I like that really helps get that commitment.
Yeah, and that's where the probe for understanding can help too. Like, why do they think that? That'll help see if they really get it too, or if they're just, great test takers and can answer those questions easily. Some other strategies uses this future mnemonic. I found this really helpful. So you can send something out to your team ahead of time and then talk about it together on rounds using your own attestations to teach. So if you come up with a teaching topic while you're doing your notes, throw it in there, that one teaching point. Don't be afraid of technology. Allow learners to use their phones on rounds to answer questions in real time, or a tablet or the computer in front of them. And even do that in front of the patient so the patient knows that you're constantly thinking about them. Using this guerrilla teaching tactics, I really like this one. See what's in the room and teach about it. So if you see a Foley catheter, talk about indications for Foley placement or when it should come out. Rainy day teaching. So if you really just can't give up those chalk talks, this is where saving a bigger talk makes more sense, maybe on a pre-call day when you have fewer patients around. And then embedding teaching moments into rounds. So don't forget history gathering skills, communication, physical exam skills. Those are all things you can do right in the moment on rounds that are still relevant to your patient, allow you to do that patient care, but still show your learners something, or reinforce skills too. Getting back to the basics is never a bad thing.
I love those. Those are great ideas. Jen, what do you do? I feel like sometimes, these are really great things, but I feel like sometimes I really have struggled with just feeling like I don't know enough to teach. Like sometimes I feel like, I see something that I want to teach about, but I just don't feel like in the moment or off the cuff, I have enough knowledge to teach. I really want to look that up or have some sort of backing before I teach on that topic. Do you have any tips for that?
I do actually. So FHM has a whole series of clinical quick talks on different topics that you can use to sort of go over just a 1-page or a 1-minute guide to teaching on different things. So an example could be on high value prescribing and, why do we look for generics over brand names for patients? And that's something you can discuss as a team. Pen Pearls is another great resource that asks clinical questions and gives you the answers right there. So you don't have to do a ton of searching to look things up, and really keeping it related to what's going on with your patient too. So it has some evidence-based information there as well.
I really like these. I feel like I can incorporate some of these into my pre-rounding, and then maybe I can kind of pick and choose some topics and sort of maybe be prepared for rounds a little bit more. And then I can maybe pick out some of these little quick things to talk about. I know some of my students really are also very tech forward, right? And I feel like I'm not as tech savvy as them. Do you have any tips to sort of help me kind of speak their language and in terms of getting on board with some technology?
Yeah, so social media is huge for our learners, especially, in COVID, post-COVID, I don't even know what to call it anymore, but lots of residency programs and other educational resources have social media accounts where they do some teaching as well. So one of the things I really like on Twitter is there's a hashtag Post-it Pearls. And this is something I like to do with my teams, again, to get that quick teaching in, make everyone responsible for teaching, where our learners can just write a teaching point. It has to fit on a Post-it, and then you share it with the team. There's visual things like visual abstracts on Twitter and Instagram, and even podcasts like Core IM do some great visual things as well. I like to use Twitter to also learn more about teaching. This MedEd Swag team has a great series on inpatient teaching. There's a whole set of slides that they have on different things and setting this up and going into deeper dives on some of the things we've talked about as well. So these are ways I like to do it. And then also, I think something we've talked about before, Dan, is doing a team Google Doc where you can kind of put your resources and sort of show your team all that you've learned in your time together too.
I love that. That's great that everybody can kind of contribute, and maybe people can pick out their own things to teach, and your learners can become teachers as well. Yeah. I love that.
Yeah. So yeah, it's overwhelming sometimes to try to teach on a clinical service, but I think as you get familiar with different tools and strategies and resources that are out there, it can make it a little less daunting, and be able to fit it into your day. And your learners will appreciate the teaching too. So keeping it simple for your learners, setting up the expectations ahead of time that you're not going to go on these 30-minute lectures, that it's really going to be succinct and to the patient, and use resources to help you. You don't have to know it all to be a great teacher. You just have to use your resources wisely, I think are some great takeaways to think about.
Thanks, Jen. I really feel so much better about teaching and teaching on the fly, and keeping it simple for both the learners and myself. I just kind of feel like there's less pressure now to really create a bunch of learning materials. This is really helpful to kind of make sure my learners are getting something without me having to do a huge heavy lift of prep work.
I agree with just how busy services are. We got to be in the moment as much as we can. So
awesome. Thanks, Jen. I appreciate your time, and I'm going to use a lot of these resources.
Great. Have a great day, Dan.
Take care. Thanks.
You too. Bye-bye.